All right. Hi, everyone. I am Jessica. I have been with Linden Oaks for over 8 years now. I've only ever been at the adolescent outpatient program in Naperville on Mill Street, and I work primarily with the middle schoolers. Other experience I've had has been in traditional outpatient therapy, community mental health, and foster care. I myself have 11-year-old twins, girl-boy twins. They'll actually be 12 in a couple weeks, and a 1-year-old Bernedoodle. His name is Bear Butts, who surprisingly just passed his therapy dog exam and will be the newest dog therapist, animal assisted therapy, for Edward Elmhurst Health, and eventually, hopefully, over to Linden Oaks as well. So, all right, first off, I wanted to share this little cartoon. I thought this was kind of funny, but also kind of sad, about kind of how reality has kind of seeped in with social media and with phone use. And it seems like it just gets younger and younger when kids get devices and tablets. And it's really changed how our kids have kind of grown up and how they interact with each other, and even how families kind of interact. So I thought this was a good kind of cartoon to show off with. Um, all right, so we're going to talk about a lot of different things as far as like the self-regulation skill. But to kind of start off, I wanted to share that there are benefits to social media. Some of you probably already know some of them, but it really can be beneficial in a lot of ways if done correctly and in moderation. It really can help to facilitate social interactions. That's especially true for individuals with maybe limited relationships due to their mental illness, their sexual or gender orientation, or maybe where they live. This is especially true for people that live like in rural areas. Um, and it can be really hard to meet people in those areas. So social media can really help facilitate that. Social media can also help to facilitate a peer social network by kind of connecting individuals that have some kind of shared interest or experience, if they're going through similar situations or live in a particular area, or even if they have some kind of diagnosis in common. Social media can help to link them together. It can help them, interact more with one another, which can help some loneliness. It can help to increase a sense of support from others. And then they can also kind of share resources and hopefully encourage one another to seek out treatment if they are struggling. So again, that's especially true in the rural areas for people that live further out that maybe don't have as much access to others, or who are possibly limited by like they're unable to leave the home. COVID was especially really helpful. It was especially helpful during COVID times to connect people. The use of interactive peer-to-peer social media can help to improve social functioning and encourage individuals to like seek out support. And it can help them protect like their privacy while communicating with each other. They could do it, a little bit more anonymously, especially if they live in a small community. But there is some risk of misinformation being shared, which we will kind of talk about in a little bit. Again, if anyone has questions as we go, feel free to write them in the chat, and Kelly will make sure I see them. Okay, one of the other benefits of interacting on social media is for those that struggle with communication. Communicating over social media can help remove some of the need to have those nonverbal cues and be able to like read body language. It can also give people a little bit more time to come up with a response or what they want to say, instead of having to do it like immediately when they're face to face with someone. However, there's a downside to it. Not having that nonverbal communication or those social cues or the ability to pick up on tone, that can make it really difficult for people to read maybe the intent to what others are trying to communicate to them. Sarcasm is a good example for that. It can be really hard to read sarcasm over like text. Okay, so what to look out for as far as social media, or as far as your child or adolescent being on social media. So with anything with kids, if you see a sudden change in behavior or mood, all of a sudden they seem really sad, really anxious, really agitated, restless, easily distracted. If they start seeming like they don't care about others or they don't have empathy towards others, and that's a change from them, that would be a concern. So any kind of like drastic change or inability or kind of refusal to communicate with others or difficulty, like a sudden difficulty with social skills. Those would all be things to kind of look out for. Sudden change in friend group could be a warning sign. It could be, could not be. A change in their dress or activities, like suddenly, your kid that's been dancing for years all of a sudden doesn't want to do dance anymore. That would kind of be a warning sign that maybe something is going on, which may or may not be related to social media, but it would definitely be something to kind of look into a little bit. Other significant changes that you would want to keep an eye out for are any changes in how they're dressing. Also how they maybe view their body, or if all of a sudden they're making comments about how they look in their clothing, if they're complaining about their weight or their muscle mass. And then again, if there's any increase in like headaches or any other kind of physical complaints, that would be something to be cautious of and maybe ask a little bit more about, because we know that a lot of depression and anxiety can be felt physically. And then sleepiness or like school refusal, those are definitely going to be kind of warning signs too, that maybe something else is going on with your child. Other things to look out for, disrupted concentration can be a result of social media or just being on devices too much. As kids are completing homework, if they are getting lots of notifications on their devices, that can really distract them, and it can cause them to take a lot longer to complete their homework or their assignments due to being distracted. Excessive use of social media can also decrease our ability to concentrate. So if your child or teen is reporting a sudden, change in their concentration level, that's different than what they've noticed or reported in the past, that would be worth asking about, like worth asking about their phone use, their social media use, how much they're, playing video games. To kind of investigate that a little bit, because if we think about, these devices, there's instant gratification. We want to search for pictures of dogs and like we have it. We don't have to wait really for anything, for any kind of information. And people can get used to that. So then if all of a sudden someone's having to wait for it, that can be really kind of hard. That can even be distressing for some people, children, teens especially. If they're struggling with sleep, they may be utilizing social media at night, staying up too late, being on it. A lot of school refusal, maybe because they haven't gotten enough sleep, which if they weren't able to fall asleep till 4 a.m, yeah, they're probably not going to want to get in bed or get up in the morning to go to school. A lot of times kids I work with, they'll say that their phones help them fall asleep. And I always kind of challenge them, because I'll say, like, if it helped you fall asleep, why don't you fall asleep till 3 o'clock in the morning? Because we know the light and just all the information at our fingertips, it wakes up certain areas of the brain. So it doesn't necessarily, it's not conducive to sleeping or good sleeping habits. Okay, so there's also concern for likes or streaks. If you notice your child is very concerned about continuing their Snapchat streaks or getting a certain number of likes on like a picture or something like that, that's also something to look out for, because really social media can be very addicting. The likes and the streaks on the different sites, they activate a certain section of our brain. It's called like the reward system of our brain. And it causes us to want to get more likes and more streaks or more of whatever it is. And that can really make it difficult to stop scrolling or spending time on that app. Anytime we have some kind of reward, whether it's food, a prize, a like, whatever, it releases dopamine in our brain. And when we use social media, we get that same kind of dopamine rush if we get a like. So our brains become wired for like this instant gratification. Gaming can do this too. It can really affect people's behavior. because it can turn into an actual addiction. Um, Imaging studies have shown that brains of those addicted to technology, they get used to that release of dopamine, and then they have a decreased ability to enjoy real life experiences. So over time, they stop doing these things and then lean even more towards technology, resulting in like an addiction. Um, Okay, so if your kid's really concerned about the likes or the streaks, that would be a concern. And then the TikTok self-diagnosis. This is something that I think therapists we've seen maybe in about the past year, year and a half or so. We had a bunch of kind of kids that came into program, and they're all kind of talking about how they think they have these other kind of diagnoses. They think they have Tourette's disorder, autism, a personality disorder. And then we would ask them, why do you think this is the case? And then they would talk about how they saw these videos on TikTok that would talk about their diagnosis, and they're like, oh, that must be what I have. Um, and the videos can be helpful in spreading awareness. And if we're really concerned about a mental health diagnosis, just like a medical diagnosis, we need to see a doctor or a professional to get that really kind of looked at and assessed properly. Okay. So social media and depression, you're all here because you're probably concerned about someone's social media or device usage. So you are probably already very familiar with the fact that, access, social media, screen time, it can cause, or not cause, but it can be linked with depression. So there's research that shows that social media doesn't cause depression, but they're linked, they're connected. There's a relationship between the two. They think that's likely due to less face-to-face interactions, and it could be a decrease in like close personal relationships and more kind of superficial, like on the surface relationships that tend to happen more over social media. Currently, teens are having a lot less face-to-face interactions with peers. That isolation can lead to more depression or depressive symptoms. Again, social media and electronic communication can be more superficial. The fear of missing out. If someone's scrolling through their Instagram and see everyone, everyone posting pictures of them being out on a Friday night having a great time, they can easily feel like they're missing out or they're the only one not going out that night. A good example of this is over spring break, even us adults, we're probably looking through different posts and it seems like everyone's in Florida, when really not everyone is, but based on what we're seeing, it appears as if we're the only ones not doing something. Us as adults can fall victim to that, and especially, kids and adolescents can definitely do the same as well. This can lead to decreased self-esteem, especially if everyone's pictures of themselves are very flattering. I always tell kids no one's going to post the bad pictures of themselves. They're only going to post the most flattering ones. And it can affect your self-esteem if you're like, looking at yourself like, oh man, I'm having a really bad hair day. And then everyone else on your social media seems beautiful and flawless. Kids can also, or people can be less physically active if they're on social media a lot of the times, which can also lead to that decreased self-esteem. And then we definitely talked about that disrupted concentration and the decreased quality of sleep. Okay, so these are some charts that I found not too long ago that really kind of show the changes in today's teens over the years. So it's taken over, an extended period of time, and it really shows kind of the decrease in their rush to drive, which for a lot of kids kind of equals independence. So we're seeing this decline in kids of really wanting to drive, wanting to hang out with friends, and then feeling more lonely. There's probably a lot of different reasons for this. COVID, I'm sure, had a lot to do with this. But even, I'm looking at the dates on these charts, this doesn't even show 2020, at least from what I can tell. So even before COVID happened, we were seeing this decline in kids getting kind of out of the house, being with each other, doing things outside of the home, and increased loneliness. So I think that's that's telling of kind of what's happening to our teens. Okay, so self-regulation. Self-regulation, it's a developmental skill. So it starts in infancy. It starts, when we have our little babies and continues into young adulthood. Um, Self-regulation is the ability to understand and manage our behavior and reactions to feelings and things happening around us. Um, so for us, self-regulation is the ability to stop watching Netflix at a certain time when we know that we have to get up for work the next morning. So us adults, we should be able to do this. We can get enough sleep. Kids, children, and adolescents are likely going to struggle more with this because they're younger, their brains are not fully developed. They're going to struggle more with self-regulation. They're not just going to be able to do it. It's something just like every other developmental skill or task or stage that we've worked with our kids on, there's going to be a slow progression. Okay, so we really want to think about self-regulation as a developmental skill. Think of our kids when, if they went trick-or-treating for Halloween, we would limit how much candy they would eat. Otherwise, they would probably eat far too much and then end up with a stomach ache. So we kind of want to think of social media and device use as kind of like Halloween candy. If we leave it to our kids to decide how much is too much, they might end up with that stomach ache or these other kind of effects of, too much device use. So there's going to be a slow progression, a slow increase in their ability to self-regulate. Just like my kids are far too young for this yet, but for those of you with teenagers, if your teen gets their license, you're probably not going to have them just drive in rush hour traffic to downtown Chicago. You're probably going to start off small, go with residential streets and then slowly work up to those kind of work up to more traffic and higher speeds and everything. So you can monitor their progress, their ability to problem solve and handle like situations as they go. So we really want to do the same thing with cell phones and with social media. We want to do it slow so we could see how they react to these different situations to see if they're able to kind of, increase the amount of time or the different kind of apps that they're on or social media sites that they're on. Okay, if your child struggles with executive functioning skills, so this is going to be any child with ADHD, they probably struggle with executive functioning skills. They're probably going to struggle more with self-regulation. If your child also has a history of like childhood trauma, any kind of neglect, traumatic brain injury, or sensory issues, so possibly people on the autism spectrum, this might also make self-regulation more challenging. So it's likely going to be something you're going to have to work with your child on to increase their skills in this area. Okay, so tips to help your teen increase their ability to regulate their social media use. Okay, so the last page I'll have some resources as far as books and different things that you can look at as parents. But what I see time and time again is to take what's on the screen that they really like and move it to more real life, like tangible activities. So if your child or teen likes drawing on a tablet, try to move it to paper, paint, pencils, those kind of things. Same with reading. If they like to read on a tablet, let's go to the library and get some paper books. Games, same kind of thing. You can buy all like the different Sudoku books and they like board games, let's do board games. But we want to take what they're doing online and move what we can to real life in-person kind of things. This is also probably pretty helpful for us adults as well. Side note, I was at was getting my hair cut last week and I was looking around the salon and everyone was on their phone, including like the workers working the front desk. And it was really kind of jarring to see everyone just on this device and no one was interacting with each other or even just looking outside. And my own kids probably get bored of me telling them this, but it's good for us to figure out how to tolerate being bored and how to stand in line, not on our phones, and just be chit chat with someone, maybe not, maybe read the magazine headlines, whatever, but it's really good for our brains to be bored. So go back on topic, either try to move screen activities to real life. It's okay for everyone to be bored, good for our brains. Um, Plan and schedule family time to keep your child busy and engage with the family other than, being on their device. Family time or outside time for everyone can be especially helpful just to help distract them from being off their device. And really, it's most effective if everyone works on reducing screen time as a family. This can really increase buy-in with your child or teen if they see that you're also working on this. It can model really healthy habits and also kind of set the tone that, hey, this is going to be healthy for all of us to spend less time on our screens. I think having designated like device-free times or places such as the dinner table, that can be really helpful for everyone sitting there. Parents, we can lead by example, but it can help us create healthy boundaries and limits and really help to communicate that face-to-face interaction and that communication that we really want, our kids, and we want everyone kind of working on that. I'm trying to think if there's anything else. Yeah, we want to encourage in-person interactions with our children if they're wanting to hang out with their friends. Hey, let's have you guys go to the park, go to Starbucks, go somewhere, and do something kind of in person. Also, if your child splits their time between more than one home, it's going to be really important for that child to have kind of the same limits and expectations at both homes. A child can learn that there's different rules at different homes, but it can be really hard on the parent that has more of those rules and expectations. I've seen this a lot where a child will have a lot of anger issues at one family member's home or like maybe one parent's home because they're the ones enforcing the limits and maybe the other parent isn't. And while, that other parent may not have the same kind of issues, that's going to cause a lot of conflict in this co-parenting relationship. And that can definitely cause a lot of stress for everyone involved. Okay. All right. So we want everyone to kind of be mindful of how screen time impacts themselves, their teen, and their mood. Noticing how people react after being on certain apps is going to be really helpful at helping to develop that insight into how they're affected by social media. So if you notice that your teen is really grumpy every time they get off Snapchat, helping them to kind of identify this and maybe brainstorm about ways that they can maybe address this. Maybe they need to block certain individuals. Maybe they need to decrease their time on this app, but kind of brainstorming and figuring out how to address that. Definitely try to reduce the number of screens or devices in the bedrooms. Ideally, we want people to charge their devices, especially children and teens, not have their devices in their bedrooms at night. You can always get an old school alarm clock if they need it for an alarm clock. At the very least, have them turn off the notifications or the reminders so then they're not hearing buzzing and beeping and everything throughout the night because that can really disrupt sleep. So turn off those notifications. I've heard a lot of good things about different parental controls for different devices. Ones I hear about often enough are the Bark app. I think Bark actually has their own phone as well. Although I'm not really familiar with that. And then the Guardian app is also one that I've heard about. Just something to kind of help set different limits, maybe monitor certain words that are being said and kind of flag certain conversations if there is a concern about content. And then lastly, we're going to want parents and everyone in the home really to model healthy social media use. If us as parents are losing our cool on a social media site or getting into like a heated debate with a stranger, our kids see that and they notice that, and that can really set the stage for them thinking like it's okay to do. And yes, we should argue with strangers when really it's not going to be super beneficial. But we want to model that healthy social media use. We want to model walking away from a conversation or from a social media interaction if it's not going to be really healthy for anyone involved. And then also how to deal with that conflict. And sometimes handling that conflict is just stopping the engagement and just kind of walking away from it and being like, you know what, this is not good for me. I'm going to walk away. And as parents, if we're able to show that to our kids, that is going to go really far in them developing these healthy skills to manage their own kind of online presence. Okay, so I get asked this a lot. How much is too much? I found the most effective way of kind of determining this is to look at the age of your child and what other activities they need to accomplish in a day. And I'm kind of talking like every activity of the day. So I encourage families to kind of start off with 24 hours in a day and then subtract everything your child needs to do in a day, including how many hours they should be sleeping, showering, mealtime, driving if they're in different activities, all those different activities that they're in, homework, sports, everything. So you're going to just subtract everything. And then that final number, well, don't forget homework too. That final number can give you a guide as far as like how much time would be even able to fit into their day. And then you can adjust that time as you see appropriate. And that can be different for, during the week and weekends, just because expectations and time requirements might be a little different. But start off with those 24 hours and then kind of subtract those different activities that they have and scheduled things. And use that as a guide. The other thing we want to do is we want to figure out what's most important to them online. There's some things that we just kind of do like mindlessly, but then maybe there's some things that are really important to them. Maybe talking or texting with their friends is really important to them, while other activities like playing a game on their phone is something they do just to kind of like pass the time. So to help them prioritize, let's look at what's most important to them and try to help our teens focus on that part. And maybe some of the busy kind of mindless scrolling stuff, we could transition that into more real life tangible things or, different hobby, that kind of thing. Um, so to go off the next one, balance social media and in-person activities and interactions. We want to help our child be able to, you know, do some different kind of activities, whether it's, reading in the family room, playing a game, having a family movie night, but really kind of creating these opportunities for them and then also encouraging them if they want to do that with their friends. And if your child has not yet received a cell phone, it's definitely recommended that you slowly give them access to technology, apps, the ability to download different apps, the ability to search the internet, and whether or not they can participate in social media. I myself, my kids, they have watches, so all they can really do is text and call people that we allow them to contact. And they're in sixth grade. They think they're the only ones that don't have phones. I know that's not the case. Um, but it works for us. It serves the need, serves the purpose, while also not giving them too much technology at one time. Because if they had a different kind of device, they could look up anything. Um, that could be good and that can be really not good. So we want to slowly increase their limits and their boundaries as they show you how responsible they are and their ability to just balance their different responsibilities and homework and schoolwork, um, chores, and all of that stuff. So again, they're not going to be the only kid without a phone. I know at least, a couple families who are waiting till like high school for different phones. If your kid already has a phone or access to social media, there's still a lot of ways you could help them improve their self-regulation skills. And also, it's not too late to start limiting them if you are concerned. It's okay to say to your child, you know what, we should have done this a while ago. I'm sorry we didn't, but we're going to do it now. Um, Your child does not have to agree. With most things we do as a parent, we put these rules in place to keep them safe. Um, and they don't have to like it, and that's okay. But we do need to make sure that they're safe and that they're in healthy environments, whether it's in person or online. So one thing I do want to note that I see quite frequently, and I know it's probably really, really intense and scary for parents, is that there are situations where children, teens, adolescents, they'll become aggressive or they'll report suicidal thoughts if a parent does try to take away their device or limit their device. This is a concern, a huge concern for multiple reasons. Um, they could be using the aggression and the report of suicidal thoughts as a way to manipulate their parents to not take their device. They can get physically aggressive. And if that's happening, first off, we definitely want to show our children that if they're getting aggressive with others, um, yes, and family members, that's not tolerated. Um, they would likely benefit from some kind of counseling or therapy, um, because working on communication and some coping strategies would probably be really, really helpful. Of course, if there's immediate safety concerns, call 911, take them to the emergency room. Um, but we definitely want to show them that like hitting and throwing things that's not to be tolerated because that's not safe for anyone in the home. And as kids get older, they get bigger, they get louder, that can be a much more dangerous situation for everyone in the home. So we want to kind of have that hard boundary, like this is unacceptable. And if you're struggling that much, I understand. We're going to help you and we're going to get you help. However, whatever that looks like. If your child's making suicidal statements saying like, hey, if you take my phone, I'm going to do something to hurt myself. Um, First off, that's a serious concern. Um, if their phone is the only thing that's keeping them safe, um, that's not okay. And they're going to need more than that phone. So they're going to need therapy, probably need to get an assessment, um, because so many things can happen with phones. They get dropped, they break, the Wi-Fi shuts off, there's a power outage, whatever. And if that device is the only thing that's keeping them from hurting themselves, um, that's not enough. We need to get them help. So I would, strongly encourage you to take them to get an assessment at a mental health facility, Linden Oaks or wherever, emergency room if you need to, or 911 if it's an emergency. But you all as parents need to be able to parent. And, we all know kids need limits. But when it comes to safety, like we need to have a strong reaction for strong statements. And if it's manipulation, okay. But still, there's consequences for the words we say. And we need to make sure that our kids are safe. So I hope none of that is happening to any of you on this call. But I'd rather you have the information than not. And you can always, put questions in the chat too if you need to. Okay, so key points to remember. Do a lot of validation when you're working with your kid on this. Because as you start to limit or set boundaries for your teen, it's going to be really difficult for them, especially if they were having if it was a little addicting for them, it's going to be really difficult for them to kind of decrease this use. So really kind of validating like, wow, it must be really hard to not be on your phone, or I understand, if you're if you feel like you're missing out on things because you're not on Snapchat. And then when they do show improvement or the ability to kind of tolerate this, we really want to like praise that. And we really want to point that out, tell them we're proud of them, all of that. Moderation is key. We're going to look at, each family situation is going to look a little bit different, but really balancing the social media use with those in-person interactions is going to be key. And helping to facilitate that as much as possible. Maybe it's getting your teen involved or your child involved in different activities, different clubs, exploring different hobbies, whatever kind of things they're interested in within reason. But If you can support them in that, that would be great, especially if it gets them kind of out doing things with other people and off their devices. That can be really healthy for them. And then again, as parents, we should really model the behavior we want to see in our kids. If we want our children to decrease their use of social media or electronics, we should really be doing it for them, doing it with them, because, you know, kids learn a lot from watching us, their parents. And if we're, up on Snapchat all night, it's going to be really hard for the kids to buy into them decreasing their their use of social media as well. So really modeling the healthy use of social media is going to be really helpful. And then again, I wanted to stress that while it would be nice for teens to agree to the rules and limits on the device, remember, it's not necessary. They don't have to agree and they don't have to like it. Parents, we set these rules and limits and everything to make sure our kids are healthy and safe. And we need to continue to do that as they get older. And it's definitely more complicated now than I think it was, when I was a teen. Um, and it's hard. So as parents, definitely get your own support if this is like a real strain for you. Everyone needs support, whether it's with family or friends. Even finding a therapist for yourself. There's a lot of therapists that really help with kind of like parent coaching. So that could be helpful. And then there are a lot of parent support groups that can be really, really beneficial. Because as parents, if we're able to get our own support, that's going to help us do what we kind of want to do with our children too. Um, so these are some of the resources that um, I was kind of mentioning. The Social Dilemma, that's a really good Netflix documentary on social media and how it's kind of designed to suck people into it, make it like addicting. Again, it's always good for people to have the information behind the stuff, but the kids don't have to agree with it. And even if they do have the information, they're not just going to want to regulate their social media use. Um, it's still going to be something they're going to have to work at, and parents will have to coach them on. This device book, the third one down, that has a lot of really good information about how to balance life and technology. It talks about all the benefits to being bored and having boredom parties. It just has a lot of really good information. And then there's a website, Wait Until 8th. There's a big push for this organization, Wait Until 8th, to have kids not get, I think, smartphones until they're in 8th grade. So they do have a lot of information, a lot of tips, and the American Psychological Association also has different articles and tips about social media as well. And again, if you are concerned about your kid for whatever reason, definitely seek an assessment. I put that number at the top. It doesn't mean they're going to go into the hospital or even a day treatment program, but you can just go for an assessment too, just to get some more information. Okay, and then here are some of the other resources that I have. There's a lot of interesting information out there. Wired Child's also another good book. On the Phone Alone, I thought that one was also really good.